Welcome to the Rescue Ride podcast, where today we're going to do a deep dive into how technology is transforming healthcare in Africa.
And it's a pretty fascinating area.
Yeah.
A lot of innovation, a lot going on.
I was just going to say we've got some sources that are talking about everything from mobile clinics and drone deliveries to public-private partnerships. Even a look at what the future holds for this exciting field.
Right. And what I think is really captivating is that, Africa faces all these healthcare challenges.
Right.
But at the same time, there's this incredible surge in innovation.
Yeah.
And this real hunger to sort of leverage technology to find solutions.
I think it's really interesting because we're talking about a continent where millions of people have difficulty accessing quality healthcare.
Yeah.
Because of geographical barriers, limited infrastructure, resources. So what stands out to you as we start to explore how tech can really make a difference in these areas?
Well, I would say the sheer resourcefulness and adaptability. You see this, for instance, in the emergence of mobile clinics.
Okay.
As a direct response to those geographical challenges.
Yeah.
And we're not just talking about a concept. This is actually happening on the ground.
Oh.
In Ethiopia, for example, there's a region that's historically had a very high maternal mortality rate.
Right.
But after they implemented a mobile clinic program that brought prenatal care and skilled birth attendants and emergency services directly to women in these remote villages,
Okay.
they saw those rates plummet by 30%.
Wow.
And that was within just 2 years of the program's launch.
That's huge, a 30% reduction.
It is.
That's amazing.
It is.
I think it kind of paints a picture, too, of just like that seemingly simple solution of bringing healthcare directly to the people
Right.
can have such a powerful impact.
Yeah.
But even with mobile clinics, I'm thinking about like ensuring a reliable supply chain in those same remote areas.
Right.
That has to be a major hurdle.
It is a huge hurdle.
Yeah.
Just think about the logistics of trying to navigate these vast distances,
Right.
often with poor roads, unreliable infrastructure, and you're trying to deliver life-saving medications.
Yeah.
And Rwanda has kind of tackled this head-on with a really brilliant system.
Okay.
They use GPS tracking and temperature-controlled trucks for vaccine distribution.
Okay.
And what they found was a remarkable increase in the number of people actually receiving those vaccines.
Oh, wow.
Simply because they're cutting down on the spoilage and the waste
So smart.
during transport.
Yeah.
It's really incredible.
It really highlights how technology isn't always about like the flashy gadgets. It's about finding these practical solutions
Right.
that can really make a difference.
Right.
But of course, even the best tech needs funding and support
Yeah.
to reach its full potential.
Yeah.
And that's where I think the concept of public-private partnerships comes in,
Exactly.
or what they call PPPs.
Exactly. PPPs are incredibly powerful for bridging this resource gap that exists in healthcare systems a lot of the time.
Yeah.
And it brings together governments and their policy frameworks and funding with the private sector, which has expertise in, technology, logistics, service delivery.
So it's kind of leveraging each partner's strengths to create a more effective solution that can be sustained.
That's right.
So I'm curious about real-world examples where PPPs have made a difference.
Sure.
What comes to mind?
Well, actually, the mobile clinics that we were talking about earlier are a really great example of successful PPPs.
Okay.
By sharing costs, expertise, and resources.
Right.
You have government agencies, private healthcare providers, even NGOs can all work together to bring these sort of mini hospitals directly to those remote populations.
I see how that could really amplify the impact.
It does.
And it's not just about the initial setup, right?
Right.
Our sources point to an organization called RescueRide Africa
Yeah.
as playing a key role in ensuring that these partnerships are successful long-term.
They go above and beyond. They don't just connect partners. They're really involved in capacity building, providing mentorship and training programs to empower local healthcare workers. So that ensures that, the benefits of these partnerships extend far beyond just the initial project and really become embedded within the community.
It's like that saying, give a man a fish and you feed him for a day. Teach a man to fish and you feed him for a lifetime.
Exactly.
That's kind of what I'm thinking about, right?
That's exactly it.
Like investing in the training, the skills development, and creating that ripple effect that can transform entire communities.
And it's not just training on existing technologies.
Yeah.
RescueRide also has this remarkable technology incubator program that's specifically designed to support African startups that are developing innovative healthcare solutions.
Okay.
So they're providing them with funding, mentorship, access to networks, resources to help them grow and scale their impact.
So it's about fostering a new generation of healthcare innovators.
Exactly. On the continent.
Yes.
Wow.
That's really what it's about.
That's incredible. Do you have any specific examples of how RescueRide has helped facilitate these kinds of groundbreaking partnerships?
Yeah, one that really stands out is their work in Malawi, where they played a really pivotal role in strengthening the country's emergency medical services.
Okay.
They connected the Ministry of Health with a private ambulance company and a tech startup to really develop a more efficient and responsive emergency medical system.
So it was a coordinated effort to address a critical need.
It was.
What were the tangible results of this partnership?
Well, the tech startup developed an app that completely revolutionized how ambulances were dispatched and patients were tracked.
Okay.
So this really streamlined approach led to significantly faster response times, which of course translates to better outcomes for patients.
That's amazing to see how technology, combined with the strategic partnerships, can have such a direct impact on people's lives.
The Malawi example also shows the power of bringing diverse expertise to the table.
Yeah.
From healthcare providers to logistics experts to tech innovators.
It really is a great illustration of how the technology's potential can be maximized when it's integrated within this thoughtful and collaborative framework.
I want to dig a little deeper into some of the specific technologies being implemented.
Okay.
We touched on mobile clinics, but what are some other innovations that are driving this healthcare transformation in Africa?
Well, one of the most exciting areas is data-driven healthcare.
Okay.
PPPs are increasingly leveraging data to make more informed decisions, to track diseases more effectively, and even to personalize healthcare delivery.
So moving beyond anecdotal evidence, using data to create more targeted and effective intervention.
That's right.
Can you give us a concrete example of how this data-driven approach is being applied?
Sure. There's this really fascinating development in using AI to analyze patient data. That's allowing for early detection of diseases like diabetes and hypertension.
Wow.
So imagine being able to identify individuals who are at risk before the disease even fully develops.
So proactive intervention.
Exactly.
That could prevent complications down the line.
Right, and improve long-term health outcomes.
That's really powerful.
It is.
It sounds like we're entering an era of precision healthcare.
We are.
Where treatments and interventions can be customized to each patient's needs and risks.
Absolutely. And this data-driven approach is being fueled by advancements in, artificial intelligence, machine learning, big data analytics.
Yeah.
These technologies are really giving us unprecedented insights into disease patterns and treatment effectiveness and even individual patient responses.
It's like having a crystal ball.
It is.
That can help predict and prevent health problems before they even arise.
It's really quite remarkable.
But of course, all this innovation requires funding and investment.
It does.
What's the financial landscape looking like for these kinds of projects in Africa?
Well, that's another area where we're seeing some really encouraging trends.
Okay.
Impact investing is gaining momentum, as more and more investors are recognizing the potential of PPPs to generate both financial returns and positive social impact.
So it's a win-win scenario.
It is a win-win.
Where investors can see a return on their investment.
Right.
But they're also contributing to improving healthcare systems and ultimately saving lives.
And it's not just philanthropy.
Right.
It's recognizing that investing in healthcare can be both ethically and financially sound.
This influx of impact investing has to be helping to scale up successful models.
It is. It's providing much-needed fuel for innovation. And it's not just large institutions getting involved.
Oh, wow.
We're seeing growing interest from individual investors who are really passionate about making a difference.
That's great.
It's creating a more dynamic and sustainable ecosystem for healthcare innovation in Africa.
This all sounds incredibly promising.
It is.
But I have to ask, are there challenges and potential roadblocks that could hinder progress in this area?
Well, one key obstacle is the issue of infrastructure limitations.
Wow.
Despite the progress that we've talked about, many parts of Africa still lack reliable access to electricity, internet connectivity, all those essential infrastructures that are really necessary to support digital health solutions.
So addressing those infrastructure gaps is essential.
Absolutely.
For unlocking the full potential of these innovations.
It is.
That's fair.
Another challenge is the digital literacy gap.
Oh, okay.
We need to make sure that both healthcare workers and patients are equipped with the skills and the knowledge to actually use these new technologies effectively.
That makes sense.
And that requires investment in training programs and educational initiatives.
So it's not just about the technology itself.
Yeah.
It's about empowering people to use it effectively and confidently.
Right. It requires a holistic approach that addresses both the technical and the human aspects of this transformation.
I think it's also crucial to acknowledge that technology has the potential to actually exacerbate existing inequalities.
That's right.
If we're not careful.
We have to be mindful of affordability and accessibility and make sure that these new solutions benefit all segments of the population.
So that we don't leave anyone behind.
Exactly.
So how can we work to mitigate those risks and ensure that these technological advancements really benefit everyone?
Well, one key strategy is to prioritize community engagement and participatory design.
No.
We need to involve local communities in the development and the implementation of these healthcare solutions.
So listening to the people who will be directly affected by these technologies.
Exactly.
And incorporating their perspectives into the design process.
From the very beginning, it's about empowering communities to be active participants in shaping their own healthcare future.
It sounds like creating a more equitable and accessible healthcare system in Africa requires a multifaceted approach.
It does.
That considers not just the technological aspects, but also the social, economic, and cultural contexts.
That's exactly right. It's a complex landscape, but the progress being made is truly inspiring.
It is.
The potential for technology to transform healthcare in Africa is immense, and I'm optimistic that with careful planning, collaboration, and a commitment to inclusivity, we can create a future where everyone has access to the quality care they deserve.
Absolutely, and that's what we're all striving for.
That's right.
It's been really remarkable to see this conversation kind of shift my perspective.
Oh, good.
Because initially, I think I was really focused on the technology itself. But you've really highlighted the importance of the human element, the training, the community engagement, the need to bridge those digital divides.
It all plays a role.
Yeah, and that's, I think, where the true power of organizations like RescueRide really lies.
Absolutely.
Because they understand that technology is just a tool.
It is.
And it's effective when it's implemented thoughtfully.
Yeah.
With a deep understanding of those local contexts.
It's not just about introducing the latest gadget. It's about working hand in hand with communities to develop sustainable and impactful solutions.
And again, going back to that idea of teaching someone to fish.
Right.
Rather than giving them a fish.
Exactly.
That investment in capacity building. Equipping healthcare workers with the skills to use technology effectively creates that ripple effect that can transform those communities.
Absolutely. It's about empowering individuals to be agents of change within their own communities.
I love that.
And RescueRide's commitment to that long-term impact extends beyond training. Their technology incubator program is really nurturing a new generation of African healthcare innovators who are going to be at the forefront of this technological revolution.
I think fostering that culture of innovation and entrepreneurship from within Africa is such a brilliant strategy.
It is.
I can only imagine how empowering it is for these startups to have access to the funding, the mentorship, the resources they need to really develop and scale their ideas.
It's about creating an ecosystem where African innovators can thrive and develop solutions that are really tailored to the unique challenges and opportunities of the continent.
As we look towards the future, it's pretty clear that these public-private partnerships are going to play an even bigger role.
They are.
In shaping the healthcare landscape in Africa. And it's been fascinating to see how those collaborations can pool resources and expertise and technology to create solutions that are greater than the sum of their parts.
I think what's really exciting is that we're witnessing the emergence of these increasingly innovative PPP models. It's not just about replicating what's been done before. It's about pushing boundaries, embracing new technologies, exploring new financing mechanisms, and forging these new partnerships to address those complex challenges of healthcare delivery.
So that spirit of innovation is incredibly encouraging because it seems like we're moving beyond the limitations of those traditional approaches and really embracing the potential of technology to drive meaningful change.
And it's not just about high-tech solutions.
Okay.
Sometimes the most impactful innovations are surprisingly simple.
Right.
Like using basic mobile phones for health education and communication has been incredibly effective in reaching remote communities and empowering individuals to take control of their own health.
Sometimes we get caught up in the excitement of the cutting-edge technology
Yeah.
and forget the power of simple, accessible solutions.
Exactly. It's all about finding the right tool for the job and making sure that technology serves the needs of the people and not the other way around.
That's a really good point.
And speaking of specific technologies, we've talked about the potential of mobile clinics, but there are so many other innovations driving this healthcare transformation in Africa, like telemedicine. That's rapidly bridging the gap between patients in remote areas and specialists who might be located hundreds of miles away.
Wow.
It's revolutionizing access to specialized care.
I never thought about it like that.
It's incredible to think that a doctor in a bustling city could be consulting with a patient in a rural village, providing expertise and guidance that might otherwise be completely inaccessible.
Really highlights the power of technology to connect people and resources in ways that we couldn't have imagined before.
Absolutely. And it's not just about connecting doctors and patients.
Oh.
Telemedicine is also being used to facilitate training and knowledge sharing among healthcare professionals, enabling them to stay up to date on the latest medical advancements and best practices no matter where they are.
It's creating a more interconnected and collaborative healthcare ecosystem.
It is.
What about drone deliveries?
Drone deliveries.
I've read about pilot programs that are using drones to transport medical supplies, medications, even blood samples to remote areas that are difficult to reach by traditional means.
It sounds like science fiction.
It does, right?
But it's happening now.
Wow.
Drone deliveries are proving to be a game changer, especially for areas with limited infrastructure or during emergencies when time is of the essence.
Right.
Imagine a rural clinic is running low on essential medication. Instead of waiting days for a delivery truck to navigate those treacherous roads, a drone can deliver those supplies within hours, potentially saving lives.
Wow. It's a perfect example of how technology can overcome those logistical barriers.
Yes.
Provide timely access to those critical resources.
Absolutely.
But I do wonder about the ethical considerations surrounding these advancements.
Right.
I think as we embrace these innovations, it's crucial that we do so responsibly and thoughtfully.
We need to be mindful of data, privacy, and security as healthcare data becomes increasingly digitized.
Okay.
Robust systems and regulations have to be in place to protect patient information from unauthorized access or misuse.
That makes sense.
And as we talked about earlier, ensuring equitable access and avoiding exacerbating existing inequalities is paramount.
Right.
We need to be really proactive in addressing potential biases, making sure that these technologies benefit all segments of society.
Those are all critical points.
They are.
It's clear that alongside the excitement and the potential, there's a responsibility to navigate these advancements ethically and to ensure they really contribute to a more just and equitable healthcare system for all.
Absolutely. It's a complex landscape, but I believe that with open dialogue, thoughtful planning, and a commitment to inclusivity, we can harness the transformative power of technology to create a brighter future for healthcare in Africa.
I think those are some really great points to reflect on.
I agree.
And I think it's been a really illuminating conversation for me so far.
Oh, good. I'm glad.
I feel like I've learned so much about the innovative solutions being implemented, those inspiring partnerships driving change, and just the importance of considering the human impact of technology.
That's really what it's all about.
I'm feeling very energized by the possibilities, but also mindful of the responsibilities.
It's a good combination.
It is a good combination,
and
it's a healthy one to have.
I agree.
So thank you.
Well, thank you. It's a field that's constantly evolving, new challenges and opportunities emerging all the time. But the dedication and ingenuity of the people working in this space give me immense hope for the future of healthcare in Africa.
As we wrap up this first part of our deep dive, I want to leave our listeners with a few key takeaways.
Okay.
First and foremost, technology is undeniably transforming healthcare in Africa. In really profound ways.
It is.
From the mobile clinics and drone deliveries to telemedicine and data-driven healthcare, these innovations are expanding access to quality care.
They are.
And they're saving lives.
Absolutely.
But it's important to remember that technology is a tool.
Yes.
And it's most effective when it's used in a way that's sensitive to local contexts and needs. And we need to prioritize community engagement, capacity building, ethical considerations to ensure that these advancements benefit everyone.
That's right.
Finally, I think it's crucial to acknowledge and celebrate the incredible talent and innovation that exists within Africa.
Absolutely.
We're seeing a new generation of healthcare leaders and entrepreneurs driving change and shaping the future of healthcare on the continent.
It's an exciting time to be involved in this field.
It is.
And I'm really optimistic about the future of healthcare in Africa.
Well, this has been an incredibly insightful conversation.
It has.
Thank you so much for joining us and sharing your expertise.
Thank you for having me.
And to everyone tuning in, we hope this deep dive has inspired you to learn more and engage with these issues.
Yes.
And consider how you can be a part of the solution.
That's what we hope.
Until next time, stay curious and stay engaged.
Stay engaged.
I'm already thinking about what I'm going to research after this.
Oh, that's great.
For our listeners who are feeling that same spark and want to learn more,
Yeah.
maybe even get involved themselves, where would you suggest they start?
Well, a great first step is simply to stay informed.
Okay.
There are so many incredible organizations doing amazing work in this field.
Yeah?
RescueRide Africa is an excellent starting point,
Okay.
but there are countless others out there as well.
So do some digging online, follow these organizations on social media, maybe dive into some in-depth articles and reports.
Exactly. The more you learn about the challenges and the solutions, the more you'll likely be inspired to get involved on some level.
And for those who've done their research and are ready to take that next step, what are some tangible ways that people can contribute?
Well, financial support is always incredibly valuable. Even a small donation can go a long way in helping these organizations expand their impact.
That makes sense, but I know not everyone is in a position to donate financially.
Right.
Are there other ways to contribute?
Absolutely. Volunteering your time and skills is invaluable. Many organizations rely heavily on volunteers for a wide range of tasks, from fundraising and event planning to research and data analysis.
It seems like there's a place for everyone regardless of their background or skill set.
There is.
And even something as simple as spreading awareness can have a ripple effect, right?
You're absolutely right. Sharing information about these organizations on social media, talking to friends and family, even just bringing it up in conversation can help raise awareness and generate support.
It's about creating that ripple effect where more and more people become aware of these issues and feel empowered to contribute in whatever way they can.
Exactly.
What about those listeners who are really passionate about this field and might be considering a career in global health or international development?
Yeah.
What advice would you give them?
I'd say go for it. There are so many opportunities in this field. Internships, fellowships, master's programs. There's a growing demand for individuals with expertise in areas like public health policy, healthcare management, technology, and innovation. If you're looking for a career that's both challenging and incredibly rewarding, this is definitely a field to explore.
It sounds like it requires more than just technical skills.
It does.
You need passion, empathy, a commitment to social justice.
That's precisely it. The work of transforming healthcare in Africa calls for people who are not only skilled, but also deeply dedicated to making a difference in the world.
It's been incredible to hear about the progress being made and the potential that lies ahead.
It has.
As we wrap up this deep dive, I want to leave our listeners with a sense of hope and possibility.
Yes.
The challenges facing healthcare in Africa are significant.
They are.
But we've seen today that solutions are within reach.
They are.
With collaboration, innovation, and a shared commitment to equity. We can create a future where everyone has access to quality care.
I couldn't agree more. It's been exciting to be a part of this conversation and explore these possibilities with you. To our listeners, thank you for joining us on this journey of discovery.
And to everyone tuning in, we hope this deep dive has inspired you to learn more and get into these. And consider how you can be a part of the solution. Until next time, stay curious and stay engaged. It's remarkable how much progress is being made and the potential that lies ahead.
It is really quite remarkable.
As we wrap up this deep dive, I want to leave our listeners with a sense of hope and possibility.
I think that's important.
The challenges facing healthcare in Africa are significant. But we've seen today that solutions are within reach.
Yeah.
With collaboration, innovation, and a shared commitment to equity.
Absolutely.
We can create a future where everyone have access to quality care.
I couldn't agree more.
For our listeners who are feeling inspired and want to learn more, maybe even get involved themselves,
Yeah.
where would you suggest they start?
Well, a great first step is simply to stay informed. There are so many incredible organizations doing amazing work in this field.
Yeah.
RescueRide Africa is an excellent starting point,
Okay.
but there are countless others out there as well.
So do some digging online, follow these organizations on social media, maybe dive into some in-depth articles and reports.
Exactly. The more you learn about the challenges and the solutions, the more you'll likely be inspired to get involved on some level.
And for those who've done their research and are ready for that next step,
Yeah.
what are some tangible ways that people can contribute?
Well, financial support is always incredibly valuable.
Oh.
Even a small donation can go a long way in helping these organizations expand their impact.
That makes sense, but I know not everyone is in a position to donate financially.
Right.
Are there other ways to contribute?
Absolutely. Volunteering your time and skills is invaluable.
Okay.
Many organizations rely heavily on volunteers for a wide range of tasks, from fundraising and event planning to research and data analysis.
It seems like there's a place for everyone, regardless of their background or skill set.
There is.
And even something as simple as spreading awareness can have a ripple effect.
Right.
Right.
You're absolutely right. Sharing information about these organizations on social media, talking to friends and family, even just bringing it up in conversation can help raise awareness and generate support.
It's about creating that ripple effect where more and more people become aware of these issues and feel empowered to contribute in whatever way they can.
Exactly.
What about those listeners who are really passionate about this field and might be considering a career in global health or international development?
Yeah.
What advice would you give them?
I'd say go for it. There are so many opportunities in this field: internships, fellowships, master's programs. There's a growing demand for individuals with expertise in areas like public health policy, healthcare management, technology, and innovation. If you're looking for a career that's both challenging and incredibly rewarding, this is definitely a field to explore.
It sounds like it requires more than just technical skills.
It does.
You need passion, empathy, and a commitment to social justice.
That's precisely it. The work of transforming healthcare in Africa calls for people who are not only skilled, but also deeply dedicated to making a difference in the world.
It's been incredible to hear about the progress being made and the potential that lies ahead.
It has been really inspiring.
As we wrap up this deep dive,
Yeah,
I want to leave our listeners with a sense of hope and possibility.
I think that's a great note to end on.
The challenges facing healthcare in Africa are significant, but we've seen today that solutions are within reach.
Absolutely.
With collaboration, innovation, and a shared commitment to equity, we can create a future where everyone has access to quality care.
I couldn't agree more. It's been exciting to be a part of this conversation and explore these possibilities with you. To our listeners, thank you for joining us on this journey of discovery.
And to everyone tuning in, we hope this deep dive has inspired you to learn more, engage with these issues, and consider how you can be a part of the solution. Until next time, stay curious and stay engaged.